Hi everyone, welcome to this video and welcome to this Public Health Dentistry channel. In this video, we are going to see about the basics of fluoride. Basics of fluoride means how it is originated, how it is used in dentistry, what is its priority and what is its place in dentistry, how it is used and how it is useful for every individual in dentistry or in patients, used in patients who come to dentistry. So the next part of this video will be continued regarding fluoride delivery methods to individuals. So now let's go into this video. So let's start with the chapter. So first we are going to see about the introduction of fluoride. Okay. So fluoride is first considered as an essential nutrient by the FDA, that is the Food and Drug Administration, in 1973. So they have told that the essential nutrient is the fluoride. Okay. Apart from this, even WHO has mentioned that fluoride is required for the growth and development of every single human being. So according to this FDA and as well as the WHO, fluoride is an inevitable part of our life. Okay. So starting with the basics. Okay. Now how do you know fluorine is from? Fluorine has its origin from the Latin word. Okay, what is the Latin word? The Latin word is fluor. It means to flow. Okay, so do you find fluorine as fluorine or some in the same form as you see now? No. As you see, fluorine is a highly electronegative element and it is readily reactive to anything that it comes across. So fluorine is not found in the same form as fluorine, whereas it is found as fluorspar, fluorapatite and cryolite. Okay, so now we have seen fluorine as in these three forms, which are available in these three forms. Okay, so what is its purpose in our dentistry? What is it going to do in our dentistry? Means its main function is to prevent us from dental caries. But there is a contradictory thought that fluorine is a double-edged sword. So at higher rates, it is going to cause toxicity or hazards to our own good, whereas at the ample amount of cost, it is going to give us prevention from dental caries. So how it is going to prevent us from dental caries? To see that, you have to know what is dental caries. So I will just explain the simple process of dental caries through its definition. So we will define dental caries. So before going into dental caries, I wanted to know what are the different sources of fluoride. Where do you find it in nature? So it is seen in water, that is we all see in communal water, because they have found the fluorine first in water only. They have found a disease called fluorosis in the 18th century or 19th century, and they have concluded that it is from the element called fluorine which is present in water. So first source is water. The second source is salmon fish. The third source is tea leaves, especially green tea leaves. And the fourth source is turmeric powder as well as raw turmeric. Then our fifth source is bananas. So these are major rich source of fluoride that are available in nature. Okay. Now we'll go about dental caries. So what do you see? What do you know about dental caries? The simple thing to understand dental caries is it is some sort of disease in the tooth which causes it to rot. Okay, so the word caries comes from the word called care, which means rot. Okay, so the basic definition of dental caries is that it is an irreversible microbial disease that causes localized dissolution to the organic part of the tooth and localized destruction to the inorganic part of the tooth. Okay. So as the definition says, it is an irreversible microbial disease. It means it cannot be reversed once it is got. So if you have got a caries, you cannot reverse it back. And further, it is caused by microbial infection. So irreversible microbial disease, what it will do is it will dissolute the organic part and destruct the inorganic part of our tooth. So our tooth is composed of both organic as well as inorganic constituents. So this caries is going to dissolute the organic and destroy the inorganic parts of the tooth, leading to rotting of the teeth. Okay, so what is this fluoride going to do with this caries? How is it going to prevent this caries? So to understand this, I'll tell you few mechanisms. Okay, how is it going to prevent caries? The first thing it is going to do to prevent caries is it is going to cause maturation. Okay, so it is going to cause enamel resistance. Okay, so in our teeth, in our whole body itself, enamel is the strongest part. Okay, so but this enamel has to be still stronger enough so that it is not eroded by this caries. So our fluorine is going to react with the crystals, hydroxyapatite crystals of our enamel, and it is going to create enamel resistance so that when the microorganism attack comes across the tooth, it is not affected by caries. Next, it will cause post-eruptive maturation. So what is post-eruptive maturation? Or normally a teeth during its eruption is getting matured and it will get erupted into the oral cavity, and the root develops later after the eruption. Now, after the tooth is developed into the oral cavity, it will not mature further. Whereas when it is exposed to fluoride, the tooth will start maturing even after eruption. A slight change of maturation is seen in the tooth which is exposed to fluorine. This maturation will help the teeth to fight against dental caries. It will not be easily affected by dental caries. In the third part, what it does is remineralization of incipient lesion. That is, there might be a small lesion which is being formed, or there may be a small demineralized part of the tooth which is a weak part of the tooth which can be easily affected by caries. Whereas this fluoride, it is going to deposit the calcium which is present in the saliva onto the tooth and cause remineralization so that the teeth has no incipient lesion or weak spots at all. So the teeth will not have caries. Then the fourth part, what it does is it interferes with the microorganisms which are present in the plaque. Okay, so plaque is generally full of microorganisms. So this plaque has its microorganisms to work on the tooth and erode it, causing caries. So this caries can be prevented when the fluoride is going to react with this plaque microorganism and destroy them. So it interferes with the plaque microorganisms. And finally, it is going to modify the tooth morphology. Not entirely as such, whereas slight changes, like a tooth may have deep pits and fissures, or it may have a sharp cusp, or it may have a deep cut or deep ridges inside. So all these things will be altered by the exposure to fluoride, so that there is no space for the food or anything to get lodged in between the tooth or on the tooth surface or on the cuspal surface, and there is no chance of even getting rot by action of microorganisms. So this form of modification in tooth morphology is done by fluorides. So you have seen what are the effects of fluoride on tooth and how it is preventing dental caries. So who are all susceptible to this dental caries means who are more eligible to get this fluoride. It doesn't mean that others are not eligible to get fluoride. The thing is, these persons are more eligible because they have a high risk of caries, whereas others do have risk, but they can also be without fluorides. But these people are compulsory that they are exposed to fluoride so that they don't have dental caries in future. So first is caries active individuals. Who are caries active individuals? Persons who are having a high risk of caries, or who are already suffering from lots of caries in their tooth, or most of the teeth affected by caries are called caries active individuals, and they are to be treated with fluoride so that they can be prevented from getting caries in future. Then children who have a short phase in eruption of tooth, that is after eruption, when they are getting immediately in a short span after the eruption of tooth, if they are getting exposed to fluoride, the maturation of the tooth will be even more better so that their teeth is not affected by caries any time in the future. Then exposed root surfaces. When few people who have recession or any forms of periodontal disease, they have their roots exposed to the oral cavity, which will in turn lead to sensitivity. This can be prevented when they are exposed to fluorides, which will cause remineralization of the root surface also, and to some extent the sensitivity can be passing. Then head and neck radiation therapy. When few cancer patients or whatever patients who are exposed to radiation therapy, they can be exposed to fluorides also, so that the demineralization or the loss of calcium which occurs in the exposure to radiation will be compensated by this fluoride exposure, so that their teeth is strong enough to withstand the radiation. Then patients with fixed and removable prostheses. So fixed and removable prostheses, these are hindrances for plaque accumulation, because hindrances for cleaning the plaque. Actually, fixed and removable prostheses will hold on the plaque in the tooth for a longer time, because the surfaces may be irregular, or it may have susceptible places, so the plaque can withstand its hold, any other forms like that. So in order so patients use some fixed and removable prostheses for chewing, they can be exposed to this form of fluoride, because they have more chances of getting plaque accumulation and caries. So patients with fixed and removable prostheses should or must undergo fluoride treatment. Then finally, patients with poor oral hygiene. Patients with poor oral hygiene are to be treated by this fluoride, because already they have poor oral hygiene, that is plaque and calculus accumulated in their tooth, which will in turn cause swarmous growth of microorganisms in their mouth, which will in turn cause dental caries. So these are the persons who are highly susceptible to have dental caries, and they are to be treated with fluoride at the most prime possible.